to go right by the. I'm going to go right by the agenda, and we're going to start it off with the discussion from the board itself. I will call upon each one of you at one time, and I'd like to hear your opinions. And we're going to start it off with Christine DeStachio.
All righty, Bob. My opinion is that we should go to mask as optional based on all the scientific information and much of it that we've received via Mrs. Fowler. Heather has sent out a bunch of results, and it's just if you follow the science like we're supposed to be doing, everything points to having them go optional. Those who feel they still need to wear them can wear them. Obviously, I think they've been, the benefits have, the disadvantages of wearing masks have far outweighed the benefits due to the lack of transmission of the virus amongst the children. And the fact that a lot of the tests are testing positive that are also just regular flu. We usually have deaths every year due to the regular flu, but because everything's become so political, it's all been made as COVID. We don't even have an infection fatality rate for kids that wear a mask. And of course, we all know the ineffectiveness of the mask, and the way our kids have been wearing them is really decreased even the tiniest bit of effectiveness that they had. The Omicron virus microns were small enough to make it through any of the cloth masks, which the majority of our kids have been wearing, and our adults. Just thinking, I know this is an issue that our teachers are very concerned with, but like I said, at this point, I think our children are more important. We have to consider them because they are still in the developmental age. And this has definitely hindered that development for many of our kids as far as their speech and development, not to mention their psychological growth and emotional growth. And that's about it. Thank you.
Thank you, Christine. Greg Perry.
There we go. Okay. All right. Got unmuted now. Hello. I am in favor of us taking the time to eliminate masks after a period where we can get our numbers to a lower level. The COVID numbers in Norwich are now at the same level that they were at in this beginning of the school year before the Omicron variant came in. And I think that if we eliminated this too quickly, we could have issues in Norwich with both the case numbers going up and with teachers getting sick. So if we give ourselves a couple of weeks for the numbers to continue trending downward like they're doing, I think that would be the smartest course of action at this point.
Thank you, Greg. Heather Fowler.
Hello, everyone. I'm Heather Fowler, and I'm sure you guys all know how I feel about the masks. I have 3 children in the school district, 8th grader, a 7th grader, and a 7-year-old who's in 1st grade. And I mean, with all the science that has come out, I've given you guys information about the masks and how they don't protect from the virus. A virus is very, very small and can go through. I've shown you guys multiple tests and evidence of that. I hope you guys took the time to look at it because it wasn't very informational. I know that my children are suffering emotionally. They're angry, they're upset. And I know that the constant things that I'm seeing in the school, children are really suffering mentally with being able to properly communicate. And I think it's because we have basically isolated them, trying to do the right thing and protect ourselves. But we've had 2 years, we've learned a lot. And I think it's time to, go with the flow, move on with our lives and help our children, because we are supposed to help their education, and children are suffering. My son has a speech problem. He's not able to see his teacher's mouth move and learn the proper way to pronounce words, which is he's having difficulty learning those sounds and reading. And as you can tell, I speak pretty fast, so I'm probably not the best helper. But I've seen my older kids have anxiety, not want to go to school. I'm sure Miss Stringfellow and anyone in the attendance office can tell you how many days my kids have missed, not only just due to the time they were out for COVID, but the times that they had anxiety attacks because they just don't feel safe and welcome at school anymore. They need those smiles from their teachers. They want those smiles for their teachers. They need to feel that relationship with their teachers or they can't trust them. We need to communicate and we need to work together and have compassion for both sides. I think masks should be optional because parents should have the right to choose what's best for their family in all medical situations. And a mask is a medical device, and I do not think that it should be forced any longer. Thank you.
Okay, Heather, thank you. Carleen?
Can you guys hear me?
Absolutely.
Thank you, Mr. Chairman. So a year ago, if this topic had come up, I would have said, no, we're really not ready to have this conversation. The vaccine rollout was just starting and we had a number of COVID cases was really high. And our community was experiencing some high level of trauma as a result of the pandemic and loss of loved ones. So as the superintendent reported last month, the COVID rate for the city of Norwich was at 124.9. And this time last year, it was at 49.3. And however, we did saw a decrease as the temperature dropped in the spring months. And then also she noted that last month, 19.18% of our students had been fully vaccinated. And from her report in November, 97% of our staff had been fully vaccinated. So I'm just taking all of those things into account as we move forward into a decision. So there are a couple of metrics that I still have some question on. So I am not sure in terms of the number of our students or staff that have rare genetic disorders or immunocompromised who may be at risk by us removing the mask mandate this evening. And I am not sure in terms of like the number of our students who may be living with elderly parents or with their grandparents who may be at a high risk of getting infected. I truly understand the frustration that people are experiencing from having to wear the mask, and I know that in some places where wearing the mask is optional, some people do use their best judgment, and having choice is something that is important to me, and in no way do I want to remove our students or our staff choices, but I want to make sure that we are doing this. We are intentionally doing this and that we're not gonna put anyone at risk over time. So a couple of other things that I've been pondering is like flu season is still in effect. Could we consider keeping the mask mandate in effect until after or at the beginning of spring? And I also want to get a better understanding in terms of how we're doing in terms of meeting some of the guidelines that the State Department of Education has recommended, specifically around what are some of the additional planning does the cabinet deems necessary to address the needs of students and staff who may be at a greater risk for the adverse health outcome, as well as what advanced contingency planning needs to occur to prepare for potential surges or outbreaks. I'm just thinking spring break coming up in the month of April. So those are some of the questions that I still have today. So that's why I want to be intentional and I want to make sure that we are taking our time as we're making this decision. Thank you.
Thank you, Carleen. Joshua Chapman?
Good evening, everybody. Can you hear me?
Yes, we can.
Yep.
So as you all are probably aware by now, I strongly support in making masks optional. I feel both with the report from the Uncas Health District and the 6 of 11 schools in the district that have already announced that they will make masks optional as well. I think this is a good time to move forward. Also, don't remember the acronym at this time, but the CDC also made a risk factor chart based on the region, and according to their numbers, at least 90% of New London County has had their first vaccination shot. And with our numbers, we are at low risk. So again, I strongly support us moving forward with making masks optional. Thank you.
Okay, thank you. Kevin Satani.
Bob, you're on mute.
I shouldn't be.
No, I can hear Bob.
I don't know. I'm on mute. Kevin?
I don't see him on the screen to unmute him. Is he still on here? Oh, there he is. Okay, hold on. He's on page 2.
Thank you.
There he is. Sorry about that.
Hello, everyone. Can everyone hear me?
Yes, Kevin.
Yes, Kevin.
Hello, everyone. And I want to thank all of the concerned citizens who are on this Zoom session as well. So before I, say what's on my mind about the masking policy, I just wanted to bring up the articles that were shared with us by a fellow board member. And of course, it took a while to, consume all of the articles and digest each one. But just for future references, when I was looking through the article, I had some concern with the ethos of a few of the articles that I was reading. And of course, I always appreciate different opinions and voices from both sides and basically all around about certain topics. But the articles that were sent to us by a fellow board member to everyone, I think it was last month, that we need to focus on things that are accurate and that are thorough with the issues that we are facing, and the information that is given to us that is science-based for us to make a informed decision. I want to stress that critical thinking is important. Data, statistics, science-driven information that are peer-reviewed multiple times and are rigorously tested and have the same review process are all important. I want the Board of Education now and in the future to basically be great role models for each other, for our students and the public at large about doing these things. So I just wanted to make that comment that I've been saving for a while about that. Now, in terms of the mask policy itself, I agree with everyone up to this point that the COVID numbers in Norwich have been going down. And I hope that the numbers will continue to go down in our city. And I do believe that we need to give the students and teachers and the parents options of wearing masks. But we can't be so hasty on this decision. And again, we need to follow the numbers. And hopefully we'll get a chance to ask some questions to the superintendent just so that we could get more information to make a sound decision. but I'm up for making masks optional at a later date. Yeah, and then just, continue to follow the numbers and hopefully everything declines. Thank you, everyone.
Thank you, Kevin. Mark Kulos?
Okay, I'm going to go off screen for a minute because I'm going to be reading a prepared statement on another screen. Hopefully you can still hear me.
Yep.
Still hear me?
Yes, you can.
Okay. All right, my prepared statement. Choice. Tonight's meeting all comes down to choice. The headline in all the media and on social networks will be, what choice did they make? It won't be about who spoke the loudest or who wore a blue shirt or decided to wear a Batman mask, even though those are all choices. Again, tonight's meeting is about choice. One in a never-ending line of choices we've been making as humans since before we can remember. At the start of COVID, no one had a choice. We were confronted with something new that could quickly infect, make people sick, and kill some of them. There were no measures or strategies in place that would protect us from a novel and unseen killer. That is scary. So the government looked at the numbers and stepped in to make certain choices. Mandates were enacted on travel restrictions, what measures people should do to best protect themselves and prevent or slow down the spread of COVID so that hospitals wouldn't be overwhelmed. Some measures worked, others not so much, as evidenced by over 800,000 American deaths, with some due to people making poor individual choices. But people don't like others making choices for them, especially if there isn't a 100% guarantee of success. So the governor and Connecticut legislature has decided to end the masking mandate for schools in Connecticut on February 28th and left the decision, the choice, to extend that date to local boards of education. There will be a decision made tonight whether to do nothing and go with the default date or to extend the mandate to a future date. Whatever happens, when that mandate ends, then the choice is left up to every parent, faculty, and staff member as to what to do. The full responsibility to protect yourselves, family members, and the community would be in your hands. We fully support the options and choices you will make as to continue to wear a mask or not. We on the BOE ask you, the public, to give your opinions on what choice we should make. Please be brief and factual. We're trying to gather your input to help us make the best choice we can for our students and school community, as we do with every vote. It is why you elected us. Please try not to be repetitious. If someone has made a point that you agree with and you wish to speak, then you can just say that you support that position. If you have something new to add, we want to hear from you. There will be time for opposing viewpoints. I want to base my decision using comments from all sides of the issue. Whatever is decided tonight will not please everyone. It may not please me, but it will be done in a deliberative and democratic manner, open for all to see. Please honor that choice and please stay safe. Thank you.
Thank you, Mark. Dr. Stringfellow.
Yes, hi.
Your opinion, please.
I wasn't ready for that. I wasn't ready
Sorry.
for my opinion. I was ready, whatever decision the Board of Ed makes, the administrators stand ready to enact that policy or vote. We've certainly heard from staff and parents and community members on both sides of the issue. What I can share with you is that our COVID numbers have been coming down significantly. They went from January 2nd, week 19, January 2nd to the 8th, 138 COVID positives, to 172, to 100, to 72, 32, 18, 6, and this week 4. I will say that it's difficult, if not impossible, to compare this year to last year because we're no longer hearing from the Department of Health on positives. These are only self-reports on mostly self-tests. So that makes it more difficult to do the comparisons that we were able to give you previously. In terms of the information we have on the vaccinated persons, we show about 98% of staff are fully vaccinated. And when the governor's executive orders expired, the obligation for public school staff to continue to get vaccinated and be vaccinated also ceased. And so that is not a number we're going to keep track of in the same way that we did previously. Now it's a voluntary share on the part of the employee. In terms of students, our numbers are relatively the same as I shared out at the Board of Ed meeting last month, with a district overall students at about 20% fully vaccinated. But again, there is no obligation for parents to share vaccination rate status. It does help our principals to do contact tracing, but it's not, I don't believe it's as accurate as it was when we were hosting the vaccine clinics. Regardless of the decision tonight, we will continue to monitor to the best of our ability vaccination rates in the community that Uncas Health provides and in the schools. We will continue to monitor virus rates that Uncas Health provides in the community and the schools. And if there is a surge, then we expect to be notified by Uncas Health. We continue to recommend and require students and staff to stay home if they're sick. We will have masks and hand sanitizer available. We will continue to assign seats on the buses, in lunch and in classrooms as best we can. Space out when feasible, avoid large crowds when feasible. Our musical instruments will still be utilizing the bell covers that have been required and we think are still a very good idea in COVID. On Monday and Tuesday, we are picking up, it was supposed to be tomorrow, but due to the snow, it'll now be Monday and Tuesday. We are picking up test kits for every student and staff member. 2 kits will be sent home to every student and staff member in all of Connecticut's public schools for personal use, in addition to the ones we've already sent out. The wishes of the Department of Health is that staff and students could please self-test just prior to whenever their community's mask choice option is implemented. We will still follow isolation nursing clinic guidelines to isolate students and staff who present with COVID symptoms, and continue to advise, let the community know about the cases that are in the Norwich Public Schools by the data dashboard on our website. Relative to something that was mentioned by a board member, I believe it was Ms. Sharmalis, about high-risk students and loved ones. Since September of 2021, students at high risk of COVID-19 complications and loved ones or family members that may be impacted by a student coming to school and then bringing home an illness, have had the option of a medical plan through the special education office. And that medical plan, as you can imagine, really takes the shape of what the child or family member's physician is advising. And then Jamie and her team investigate, meet with the family to talk about how the school can support that medical advice. And so we have, since September, have some students that have opted for homeschooling or tutoring, who have limited interaction within the school, don't necessarily attend all of the programs at the advice of their physician. And so I hope that that's helpful for you as you're contemplating this important decision.
Thank you, Kristen. From the board, is there any questions for Dr. Stringfellow on the comments she just made? No questions from the board?
Yeah, I have one. I just would be curious, you mentioned about getting feedback from staff and from parents. I would just like to know more about what the results of that were, like what you heard from Norwich staff members and from parents, if you've surveyed them or got feedback from them.
I'm sorry, I'm trying to unmute. I apologize. So the Norwich teachers did survey the teachers, and they've apprised us that the feedback was mixed, 50-50 or just about 50-50. So partially, yes, keep the masks, and the other part, no, please let masks be optional. We have not conducted a formal survey. We can do that if that is the request of the board. I can say I've heard and we've heard really good, solid arguments on both sides of the conversation. Certainly everything that our Board of Ed members have very thoughtfully expressed this evening, from the students wanting to see their friends' smiles and the faces of their teachers and the science, and also the worry and the worry about rates in Norwich versus rates in other communities that have either higher vaccination rates or lower COVID cases, but understanding that we're not seeing the rates in the schools that we were in the beginning of January.
Kevin?
Thank you, Bob. Yeah, I was trying to fit around with my mute button too. But Greg asked one of the questions I wanted to ask the superintendent for tonight is obviously about what does the teachers union think about the issue. So thank you, Kristen, for answering that. And you also answered a question too about what is the contingency plan for if the board decides to uplift the mask policy, how would Norwich Public School be able to handle students and teachers and even parents who walk through our buildings when they come back from spring break, for example, and then they, catch something from wherever, from like if they, catch COVID-19 from wherever they go, and then they bring it to Norwich Public School, how will our school district handle that? And you listed off a lot of contingency plans, and I greatly appreciate that. The only question I have now is, in addition to those strategies that's in place, are there any like other advanced strategies that is prepared just in case the COVID number in Norwich goes up significantly?
Thank you, Kevin.
Trying to unmute, and I think Amber and I are okay. So when you say advanced strategies, certainly we have been given N95 masks, test kits. We have surveyed parents and staff and asked who would like more of these. We will continue to do that if there are families and staff members that feel they don't have an adequate home supply of masks and test kits after Monday, or certainly, thereafter, they should contact their school principal. We are keeping a significant amount of COVID-19 tests in the nurse's office, and we are continuing to do what we've done since the beginning of the pandemic. If a staff member or a student presents with COVID symptoms, with parental permission, our nurses will test the student. We hand our staff members a test, and they'll be able to tell in terms of the home testing if they're positive. If things became drastic, then we would, as we did all throughout the pandemic, take our direction from Uncas Health, and they would, I would imagine, put back some restrictions. Whether those, it's hard to predict what those restrictions would be. I mean, I certainly didn't predict Omicron and how it presented so very differently than Delta and the first virus, but they are the health experts, and I'm certain will advise us accordingly should that happen.
Thank you, Kristen.
Heather Fowler? You're still muted, Heather. There you go.
My mouse was going a little bonkers. It was having a ADD movement. No, I literally, I mean, I don't have a question. I just wanted to also, it was something that I wanted to say earlier. So I looked into the Uncas Health District, and we have 11 towns in our district. And right now, 7 of them have chose to go mask optional. I mean, and I understand both sides of the story. I have autoimmune disease as well. And so I know that there can be complications and stuff like this, but I just feel that we have to have a solution. The solution can't be bigger than the problem, and the mental health of these kids is drastically changing. I mean, we cannot deny the things that are going on in our schools. The kids are out of control, and I think a lot of it is they see through it. And I'll tell you what, on the weekends, they're hanging out with their friends. They're not wearing masks. They're not. And it really makes it pointless that they feel that the only place they are forced to wear it is at this place that they are forced to go to 40 hours a day. And they want to feel welcomed, and they want to feel loved. And I know the teachers want to love them and welcome them again with smiles. I see Miss Bellevue there. I know she was my son's 6th grade math teacher. I know that we have difference of opinions, but I want to let you know that I respect that opinion, and I want to keep you safe as well. But I also want the choice for our children. And I think after 2 years, I think it's time to start making progress in the right direction of compromise. Thank you.
Welcome. Any other board members have a question for Dr. Stringfellow? No other board members? Okay. All right, we're going to go on to agenda, going with our agenda. It's going to be next section is public comment. Now, we have well over 120 people in this Zoom meeting, which I like to see that at all meetings. However, we cannot, by bylaws, have each and every one of you speak for the 3 minutes. So I am going to ask that we're going to split this up. I want to hear from both the people who are in favor of lifting the mandate. And I also want to hear from the participants tonight who are not in favor of lifting the mandate and want to see a possible extension, have it be extended. We're going to time the talks. Each person will have 3 minutes. You'll be timed by Carleen Sharmless. She'll hold up the time left. At the 3 minutes, you will be muted out by the host of the meeting. So make good choices as far as your time. And let me just read one other thing to you. This board welcomes public comment as it represents an opportunity for the members of the public to express their views to the board on matters within the board's authority. On behalf of the board, I wish to remind those offering comments that, consistent with our bylaws, we ask speakers please limit their comments to 3 minutes, and there is a maximum of 30 minutes for each subject matter. We only have one subject on the table today, so it's going to be 30 minutes. 10 people will be speaking. I like to hear 5 that want the mask mandate to extend, and 5 that do not want the mask mandate to extend. And we'll ask you to raise your hand through the Zoom app. All speakers must maintain appropriate standards of decorum. No boisterous or inappropriate conduct is permitted. We expect comments to be respectful and civil in tone, and we do not permit name calling, raised voices, or vulgarity. All comments must be directed to the board and not to any individual board member or individual member of the administration. As noted, public comment is your opportunity to convey your views to the board. It is not a question and answer session. The board and the administration will not be responding to questions or engaging with dialogue during the public comment period. The board and the administration will determine whether, when, and how to address questions that are concerning this subject matter that arise during the public comment period. And lastly, when you are called upon, please state your full name for the record and your address. Thank you. I would now like to hear from
Chairman Aldi, I believe Board Member Chapman has his hand up.
under public comment. We're in public comment.
Yes, I'm sorry. I didn't want to make a public comment. I just wanted to put in a 2 cent for you. Rather than limiting everyone to just 10 participants, I thought maybe giving everyone 2 minutes and trying to get everybody that we could in the half an hour might be better. That's just a suggestion, you know. I just feel like probably all 130 participants aren't trying to speak, and we might be able to hear from more people that way.
Thank you for your suggestion, Mr. Chapman. Anything else before we go to public comment? I need to know 5 people to raise their hand. I'd like to know who is not in favor of eliminating not in favor of eliminating the mask mandate. Please raise your hand. I'm sorry, raise your hand through the through the app on Zoom. Michaela DeStasio. Michaela DeStasio.
Hi, sorry, Bob. So in March 2020, when the pandemic hit, teachers were the unsung heroes of our society. We created lessons for our students, posted videos, called their houses to check in on them, and worked countless hours to make sure that our students were still receiving an education. Fast forward to February 2020. Unsung hero is not how I feel now. I feel undervalued, underappreciated, and looked down upon when my opinions do not match others. But here I am waking up every single day, getting to work early, working loads of unpaid overtime for the kids of our city. Do I believe that everyone should have a choice in what we wear? Absolutely. But let's take into consideration the teacher who has a child at home with cancer or a loved one with some kind of illness that would make it impossible for them to recover if they contracted COVID. All I am seeing is unmask our kids. They deserve better. What about us, the teachers? We are tired, burnt out. It has been a long 2 years. And believe me when I tell you that I am tired of wearing a mask. I am tired of not being able to see my students laugh or smile when I crack a joke. My voice is tired at the end of each and every single day. From daily read alouds, teaching mini lessons, organizing games at recess, comforting my students when they feel down, and the countless other tasks I am inundated with each day. Not once have I read a comment on any form of social media caring about the well-being of our teachers and their opinions. A simple, what do the teachers think about this? Well, this is mine. Of course, I do not want to wear a mask. I want to see my kids smile and have that true connection. But I believe in the science a little bit more, in keeping my loved ones at home and my students who have become my family this year safe. Board of Ed, I challenge you to take what I said into consideration. We are taught to teach our kids to be resilient. I'll leave you with my favorite quote from my teaching career thus far. Miss D, I'm so happy to be back in person with you. It is not the same hearing you teach in person as it is through a Google Meet. I would rather wear a mask than be away from you any longer. It was magic having all my students back in person last year in March, masks or not. Our kids, my students, are some of the most resilient people I have and ever will meet in my life. The true trauma our kids faced was remote learning. Thank you.
Thank you very much. Miss or Mrs. Bellevue.
Good evening. I'm Beth Bellevue. I am a teacher at Global Studies, as well as a resident of Norwich at 5 Tower Hill Road. I just wanted to comment. I am totally in agreement as a teacher of missing the kids' smiles and disliking wearing a mask myself. However, one of my concerns is making masks optional is putting extra pressure on our students by them having the pressure of home saying, please mask and be responsible, and school being with all their friends and the friends that are unmasked, possibly making comments and making them feel like they need to be part of the group that's unmasked. And nothing wrong with the unmasked students at all, but the student that's masked may have somebody that's compromised at home, or they themselves may be compromised. And just to have that additional pressure put on them concerns me a great deal. And my comment about the numbers have gone down a few weeks, since a few weeks after December break, the students had less time to be with their peers unmasked. So now they are masked again and the numbers seem to be getting better. So I'm just hopeful that the board will consider the mask optional to at least be put off for a while and help us to figure out how to best go through this process. Thank you.
Thank you, Mrs. Bellevue. Mr. Kalinowski? Mr. Kalinowski.
I've unmuted him. I don't know what he's doing.
Mr. Kalinowski, you're muted. Or we can't hear you, sir. No, go ahead. No, still can't hear you, sir. No, sir. Still cannot hear you. It's an adorable son you have there. I'm sorry, Mr. Kalinowski. I don't know what, I can see you fine. I can see your son fine. We just can't hear you. Okay. Sorry about that. Mrs. Cormier? Mrs. Cormier?
Hi there, how are you?
Good morning, good afternoon, good evening.
It feels
Hit 'em
like
all.
morning.
I hear
Thank
them all.
you. I am a teacher at Kelly Middle School, science teacher, and I live at 27 Lady Slipper Lane. And I just wanted to address a couple of things. As a science teacher, I'm concerned from what I'm hearing by certain members of the Board of Education, quoting science facts that I'm not quite sure are true. One thing saying that the masks don't work because COVID is so small that it goes through the masks. So COVID is very, very small, but it attaches through the respiratory system and it attaches to particulates of when you're breathing. So it's the water vapor that comes out of your mouth. So because it attaches and that's how it's transmitted in the air, it's airborne, it actually gets caught in the masks. So I'm not sure where the science came in that the masks aren't working with that. Also, I was pretty offended, just going to put this out there, and concerned about how people feel, some board members representing our students, when they say they have an ADD moment. What does that mean? You're having an ADD moment.
Ms. Cormier, we're getting notified that your network bandwidth is low. And now you are muted.
Can you hear me now?
Yes, ma'am.
Oh, I'm so sorry. So the ADD comment was concerning when a board member makes a comment like that. So that is concerning. I wonder how many board members have been to our schools. Mr. Robert, can you still hear me?
I can hear you fine.
Thank you. So I'm wondering how many board members have been to our schools, because I can tell you in my school and my team of 100 students, they wear their masks. And when a child coughs near them, they want their masks on. And if my mask has slipped, they say, put your mask up, Mrs. Cormier. So I'm concerned about that. The other thing is saying that our schools are out of control because of masks. Do we have scientific research for that bases that? So I would like to know from board members who claim to have scientific information, where is the scientific information on that, please? It amazes me as Board of Education members have not come to our schools and are making decisions and through things like, oh, I don't know, Norwich Community Forum on Facebook. That really concerns me. Should our masks be optional? That's fine. If that's how you go, that's fine. But just remember, When Delta was coming down, Omicron hit. This is a virus. Viruses mutate. And once you say, okay, no masks, what are you going to do? And if children don't need to wear masks in school, are they also not going to be required to wear a mask at the pediatricians and other places as well? So my concern is, have you really thought this through, or are you putting your opinion and making decisions for the children? Are you influencing your child, or have you included them in the conversation?
Mrs. Cormier, I just wanted to note that your time is off. I did allow it 30 more seconds for the technical difficulties you were having.
Thank you, Carlene. Thank you, Mrs. Cormier. I have room for one more individual in this meeting to state their case as to why we shouldn't lift the mandate. One more person. Please use the raise the hand button so I can see it on my screen. By the way, did Mr. Kalinowski, did you fix your by any chance fix your mute? Okay. Is there anybody? Oh, here we go. Mr. Kalinowski, are you available to talk now? I see your hand is raised. Okay, thank you. Mr. Colella?
Muted?
Mr. Colella?
Aye. Can
Aye.
My name is Janie Colella. I do have cancer and I have no immune system. And my son goes to Moriarty School. And I would like to see us listen to the CDC guidelines and what the medical profession has to say and keep the masks in place. Thank you.
Thank you, Mrs. Colella. Okay. I will now ask for 5 individuals to use the raise the hand button on the app so we can have 5 individuals state their case why we should remove the masks from our children. Let's see. Bear with me 1 minute, please. Fedra Brown.
Hi, can you hear me?
Fedra? Yes, ma'am.
Hi,
Good evening.
my name is Fedra Brown. Good evening. I am from Old Canterbury. I have 3 children in the Norwich school system, 2 of which are autoimmune compromised. I have lost a parent to COVID. I've had well share of experience with it. And one question I have is, we keep saying that we're going to be, if we're opposed to it, we are waiting to remove the mask. What exactly are we waiting for? The numbers are as low as they have ever been. And it is something where, just like we respect each other when we wear different attires for our religious beliefs or for our personal beliefs, our children are taught that. And when our children go to school with someone that looks different or dresses different, they are taught to be accepting of that. Why is it that we are afraid that our children are going to be segregated, whether or not they do or do not wear masks in school, when our job as parents and our job as school members are to teach acceptance within our schools? So giving our children the decision, and I know myself, I will have a conversation with my children like I do every day of what they wish to do. I have a child who is in 1st grade, and my daughter has never been to school without a mask. She doesn't know what it's like to go to school without a mask. She doesn't know what it's like to go into the bus or go into school and have someone smile at them and say good morning. And someone who needs the visual cues to know what's going on and how to behave and how to react. It's very important. My daughter is learning how to read, and the key factors of learning how to read is watching someone enunciate words and watching someone sound out words. How is my child supposed to get the appropriate education when she cannot get the full lesson plan? And the fact that, you know, as individuals, as adults, we're sitting here saying that this is for a comfort of a, you know, of an adult that we want to wear a mask, or it's for a comfort of a child that we don't. We're all in this together. We've all been battling this for the past 2 years together, over 2 years together. And I think it's time that we allow everyone to do what's comfortable for them. We've all had a hard last few years. We've all had losses. We've all had, you know, sacrifices we've had to make for our families. And it's time that our families make the decisions to what's going to work best for their children, and let their children have a say in what they have the option of doing, whether or not to wear masks. So by removing by making masks optional, it's going to allow the children to now finally, after 2.5 years, to have a voice.
Thank you. Sam. So all I see is Sam on the screen.
Hi, it's actually under my husband's name. It's Christina Carter. I'm at 126 Scotland Road. So I prepared a statement. I can't believe some of the stuff that I've heard, but I'm just going to read this. Never in my life did I imagine that having kids meant I would have to plead with a group of strangers for control of lack of decisions about my child. No one did, and no one should have to, but here we are. For 2 years, anyone who was opposed to masks has been forced to send their child to school wearing one, no matter your own feelings. 2 years. Our opinions meant nothing. 2 years and many surges later, despite the mask wearing, here we are again, screaming at the top of our lungs. For 2 years, I've been forced to give in to what someone else wanted. The time has come to give control back to us, the parents. No one that is anti-mask is asking for a ban on them. No one who wants the masks to end is asking for anything more than control over their own children. None of the board members have ever been to my house. They don't put my children to sleep at night. They don't make them breakfast in the morning. They also don't have to quell the tears when the frustration from learning letters without seeing teachers' lips finally bubbles over. D and B sound very similar when you can't see the mouth that's saying them. We are one of 6 states in the nation that is still hanging on to mask. One of 6 of 50. That means 44 have already done away with them just fine. We are 1 town out of 21 in New London County. More than half have already made decisions regarding masks. 0 have voted to or decided in favor of keeping them mandated. I repeat, all the New London County schools who have met and decided have voted in favor of parent choice regarding masks. Our city needs to follow suit. I find it interesting that the board's media representative says that it's the job of the board to make a decision that's right for students, staff, and faculty, yet no one bothered asking the parents of those students. Are you under the impression that you know better than the people who raised them? Last time I checked, there were multiple members of the board who don't have children currently in the school system, and some that never have. Why are the decisions being made by you and not by us, the parents of the children who we're talking about? Why did our city not send a survey to parents of the students to get their take? NFA did, and the response was overwhelmingly in favor of masks being optional. There is no doubt in my mind that Norwich Public Schools would be the same. In closing, I'd like to remind you the only way to satisfy both sides of this issue is parent choice. With this scenario, a parent who wants their child to wear a mask is free to do so, and parents who don't want their child to wear a mask are also free to do so. This answer seems to be common sense to me. Thank you.
Thank you. Jill LeBlanc.
Hi, my name is Jill LeBlanc. I have a 5-year-old daughter. I'm at 67 Reynolds Road. Now, I could throw in so much stuff, but I don't think I could possibly say anything better than Sam just put it. And so if it gives somebody another minute or one more person a chance to say they don't want their kid masked, I'm going to give the rest of my time up. But I am for mask being a choice of the parents. And that's just, I'm going to leave it.
Thank you. Ashley Packard. Ashley Packard, am I correct? Am I saying it correctly?
Yes, you are. Can you hear me
Okay,
now?
yes.
Hi, so I also prepared a statement, but I would also want somebody else to have the chance to say that they are for parent choice. So I'll just also say that I'm for parent choice.
Thank you. Let's see here. Cassie,
Hi, can you hear me?
yes, we can. Thank you.
Okay. All right. It's Casey Ensling. I actually live at 11 Melrose Park. I have 3 children in the Norwich school system, and I agree with everything Christina said. I actually got emotional about it, and Fredra. So I think masks should be optional at this point, and it's literally is common sense, and it both sides. Like, we're not saying you can't wear a mask. You wear a mask or you don't wear a mask, but it's the option. Thank you.
You're welcome. Thank you. Mr. Kalinowski, I see your still hand is raised, but your video is off, so I'm assuming you don't, okay. Is there any, I got one more person left who wants it. It's an open seat. Raise your hand. Let me know, please. Okay. Bear with me one moment, please. All right. Oh. Lynn.
Hello.
Lynn.
Hello. My name is Lynn Bagg. I live at 19 McKinley Avenue, and I have a daughter that is in middle school in the Norwich Public School Systems. And I too would just like to put out there that I think the masks should be optional. I think that it is time to move on. We've been doing this for a while. The science says that it's okay. And I would implore the board to ask if there are any parents who would like to explain their point on whether the mask it should not come off, only because the ones that spoke tonight were teachers. And although we do value their opinion, they have been amazing over the course of the last couple of years. I think this comment section was meant to hear what the parents want. And I think that it's important to hear that. Thank you very much.
Thank you very much, Lynn. All right. That closes out the public comment section of our meeting. Moving on to our next agenda item, and that's an action item. A discussion and possible action regarding the mask mandate as brought on through this special meeting tonight. At this point, I will ask for a motion from the floor.
Excuse me, I'm sorry, Bob. I'm not trying to be rude in any way, but we do have one more hand up, and I think it would be beneficial to hear the last person with their hand up so that everyone feels heard.
Yeah, if I might comment also, Bob, yeah, we'd like to hear from Ms. Quay, and Mr. Kalinowski had problems before. If he solved his problems, I don't know. We would like to hear from those two, and I believe those would be the two final speakers. If we need a motion to continue public comment, I can make that motion.
No, don't need to.
All right.
This-
So let's, if the board is in agreement, just nod your heads. We'd
Yes.
like
Just-
to probably continue with those two.
I didn't see.
Yeah, I just wanted to note that we do have 6 more minutes left and the 30 minutes allocated for that
Oh, okay.
comment. So you have
Yeah,
time.
we're flying through. Good.
Good. What's the person? I don't see it.
It's me,
Jess
it's Jess
Quay.
Quay.
Okay, there you go.
Hi, everybody, Jess Quay, 321 Old Canterbury Turnpike. Thank you, Heather, for speaking up. I have a lot of things that I could say. This meeting is really hitting some nerves with a lot of people. I think it's absolutely ridiculous that you're limiting the people of this town to 5 and 5. I think that's absolutely ridiculous. You want people to come to your meetings to speak their mind about what's happening in our school to our children, and yet you cannot hold this in person, and you limited it to 5 and 5. I don't know the legalities of that, but I know that you wouldn't be able to do that if we were in person, and I find that despicable. I am not one way or the other. I'm not a pro-masker. I'm not an anti-mask person. I could go either way. I am pro letting our children getting back to some normalcy. My kids started school 2 years ago, 2.5 years ago. They've had 4 months in their entire life without masks. I think that it's time to get past this. I think it's time to move on. And of course, I want our teachers to be protected. I don't want anyone to get sick. I myself don't want to get sick, but that happened anyways. If we're being honest, we've had it too. So I do think that masks work, but I think that it's time for us to be able to make our choice for our children. My kids, one of them wants to continue wearing it, the other two don't. I have the same back and forth in my own household, and I don't care at this point what they want to do, what they feel comfortable with. I think that we really need to let the parents have a say in this. And honestly, I don't know why you guys haven't sent out a survey to parents. You don't even know what we want to do or what we feel comfortable with. And I mimic the same thing that Christina said, where if you want to wear a mask, please wear a mask. Well, I'm still wearing a mask everywhere I go. But if you don't want your kids to wear a mask, they shouldn't be forced to. Literally, school is the only place that they're being forced to wear a mask. And I'm not an unmasked person. That's it. Thank you.
You're welcome. Thank you. Carlene, how are we doing on time?
A few more minutes. Peace.
Peace, Omo, Edo.
You're good on time.
Very much.
Boys.
Your
Hello,
name
can
and
you
your
hear me
address,
okay?
please?
Yes, my name is Elliot. Actually, Peace is my wife. My name is Elliot Omo Edo. I am 155 Briar Lane in Norwich. I have a 5-year-old in kindergarten. I just want to chip in that I don't think we're out of the woods yet with the virus. I know we are careful. Everybody wants to get back to normalcy and life. I am an infectious disease specialist. I see the numbers. I attend to people every day. Yes, the numbers are going down, but I don't think we're out of the woods yet. I would say we should keep the mask on until just a little bit and see how this where this leads. The numbers are going down. It's okay, but we are not out of the woods yet. It's still very contagious. People are still getting very sick. Kids are very vulnerable, especially those in schools. and the transmission rate, the epidemiology, it's crazy. I know everybody wants to get back to normalcy, but I still think we should keep the mask on just for a little bit, a couple of months, then we can talk about putting the max down. Yeah, I don't know what data people are looking at. The numbers are going down, then so we should just throw all cautions to the wind. I don't know about that, but the numbers are going down. It's promising, but that doesn't mean that we should just throw all cautions out. I still think we should hold it down for a little bit and see where it goes after the winter, and we can start to think about completely leaving the mask out. That's just my little contribution to this. Thank you.
Thank you, sir.
So, Mr. Chair, we are at 6:43. We are at time right now. So I think before Mr. Kulos was going to make a motion to extend it, if that is the pleasure of the board, but I'm passing it back to you.
We are at the point now where, let's see. Ashley, you have your hand raised again? You want to speak? What do you got, Ashley? Go ahead.
Okay, so I was gonna read my statement, but I'm not gonna read that, but I am gonna ask just one question. So my name is Ashley Packard, and I live on 21 Lincoln Ave. So you guys are talking about the viruses and all that. So and part of my statement, I'm just gonna read it because I'm really bad at public speaking. So it says, you were elected by us, the parents, and if you choose to continue with these mask mandates, I am requesting that you provide to me and all of the other parents speaking out with documentation showing peer-reviewed studies showing that masks are effective from blocking a virus, let alone COVID-19 virus. I can guarantee that you will find nothing, but what you will find are the devastating, long-lasting negative effects that masks have had on our children. So I'm asking you, for the sake of all of our children and the mask mandate now, as the surrounding towns did, it is time to give our children our lives back with the hope of tomorrow for a better day. So if anybody could find me one of those studies telling me that these masks actually work, because my boyfriend worked at Mohegan Sun and he got COVID wearing masks. Everybody was wearing masks. He come home, we live life the same way, and none of us got COVID. So I don't believe any of that stuff. I just don't believe that the masks work, and I just want them to end. I'm just tired.
Okay.
All right, I'm done.
Thank you.
You're welcome.
And I'm going to call on Mr. Kalinowski because he apparently, I think he has fixed his unmuting problem. Mr. Kalinowski?
Yeah, I just switched over to my cell phone.
There you go. Okay.
Yeah, so I'm strongly against the masks. I do think that they're very distracting in the classroom. I have a kindergartner. She's speech delayed. She was speech delayed before the pandemic. And I don't believe that the masks are going to help her speech delay problem progress any better. She's currently at Moriarty Elementary School. I should have said my address, 18 Lilybridge Road, Norwich. But she's currently speech delayed. She is part of the speech program, and I don't think she's going to make any progress with her speech if we're keeping her with masks on. The other problem that I have, and I've had this in the past, where she's been disciplined for pulling her mask down at the Bridges program, and nothing against the Bridges teachers. They are amazing, and I understand that they're dealing with the crankiest of children because they have been at school since I put my kid on the bus at 8:30. So the Bridges teachers are amazing. I understand, but it's also, I would believe that it's making the children's lives that much more miserable because they're expected to get on the bus at 8:30 in the morning with this mask that's getting wet and filled with snot. And then they're expected to wear it till like 5 o'clock, some of the students, the ones that are part of the after school program. The other problem that I have with the masks is that I have been through proper mask training through the OSHA program. None of these kids have. They don't know how to wear the mask. So how do you expect the mask to do anything for the children if they have never been trained on how to properly wear a mask? They're going to constantly fidget. They're going to touch it. and then they're gonna pull it down, they're gonna sneeze in it. They're not gonna change it out in the proper frequency to change the mask. They're in the same cloth mask for the entire day. So I see them being more of a danger to their health because they're breathing in these snotty, boogery, filled with bacteria and viruses masks for more than 8 hours. They're not changing them out. They're made of cloth. There's proof that these cloth masks don't even do anything. So they should be wearing N95 masks, but N95 masks are only fitted for adult faces. So they won't even do anything on the children. And that's pretty much where I stand with that. And I think I could end with that because everyone else who opposed pretty much said everything that I was going to say.
Okay. Thank you very much.
Thank you.
You're welcome. That concludes public comment. Public comment is now closed. Next item on the agenda, the action item. At this time, I move for I'm looking for a motion from the floor. Is there a motion from the floor?
All right, we're finally allowed to unmute. Okay. Yeah, Mr. Chairman, I would like first to preface my motion. Well, whatever we do today, unfortunately, the CDC still has control over public transportation, and school buses are considered part of public transportation. So their masking policy will still be in effect. They're supposed to lift it for all public transportation, planes, trains, and buses on March 18th. So we could run into a situation where the kids have to wear a mask on the buses to and from school, and then unmask in school, and they get back on the bus and have their mask put back on in order to ride the buses back home. So my motion would be, I'm going to make a motion to extend the mask mandate through the end of March 18th, so that starting on the 19th of March, which would be the weekend, we go to a maskless policy. So that would put us in conjunction with the ending of the mask mandates on school buses. And that way parents would not have to worry about sending kids with a mask to and from school on the school buses, and the confusion with children. They probably would not understand, especially the younger ones. I have to wear a mask on the bus, but I don't have to wear it in school. So my motion is to extend the mask mandate for Norwich Public Schools to coincide with the ending of the CDC guidelines on March 18.
Thank you, Mark. I have a motion on the floor. Do I have a second?
A second.
Second by Greg Perry. Discussion.
Yeah, I would like to discuss this issue. I believe that unless the bus company is unless the bus company is private, if the bus company is privately owned, then that's not the guideline. We don't have our own bus service. I think because we use First Student, it lies on what they want. And moving forward, even if the CDC said it's okay, it's up to First Student. It's not, I don't believe that's in our hands.
And also, if you go to uscodes.house.gov, chapter 49, subtitle 3, chapter 53, section 15B, I can gladly email it to everybody. Public transportation clearly states there that it is school buses are not part of public transportation, as I cannot get on my school bus. And I also wanted to announce that there was, comments about board members being able to attend schools. I've tried to go into schools and they haven't let us. I haven't been able to get in my kids' schools for 2 years. So I would like to not have the COVID mandates be used against me as me not trying to go to the schools. I have adopted Teachers Memorial in Mahan Elementary School. And as soon as they let adults and visitors in, I plan on being there all the time because I care about these kids, not only mine, but the kids that my children are going to live with in a society when they're adults. And I want what's best for all of them. Thank you.
All right, I respectfully would say that the CDC has made decisions that school buses are considered public transportation and they do fall under their masking purview. So the federal mandates apply to all school buses nationwide. So those masking mandates are still in effect for school buses. Also, my other point would be that Norwich is an exception throughout the Eastern Connecticut. We have an especially high incidence numbers. Our transmission rate is very high. It is coming down, but it is still high related to other towns in the district. Norwich and New London are probably the exceptions to the rule. It was for a while East Lyme and Montville at the beginning because of their high prison population and the incidences in the prisons, but they've got that under control. So it's really, I would love to see, our numbers, our transmission rates drop a bit. And that 3 weeks, the weather will get better. Hopefully, we should be able to, teachers in classrooms should be able to open windows, let fresh air in, because fresh air is the enemy of COVID. So that's my point as far as extending it to coincide first with the, to avoid the confusion with the buses and the CDC mandate, and also the high transmission rates in Norwich.
Thank you. Do we have any other comments?
Yeah, I'll go next. I will say, I personally want the masks gone as a PE teacher. God, it's awful. I want to not have to do outdoor mask breaks. I want my water fountains back. I want us to get back to all of the stuff we used to be able to do. But I would support Mr. Koulos's proposal here, because as was mentioned by one of the people in public comment, I don't see, looking at the numbers, that we are out of the woods yet. And if they keep trending the way that they are, I think in a couple of weeks, we're going to be in much better shape. And we're going to have the beginning of spring, it'll be the end of flu season. So I think that's a good compromise and way to go, is that if we give ourselves till both the bus mandate would be over, we have the start of springtime, a few more weeks to keep trending in the right direction, to me would be a smart choice.
Thank you, Greg. Anyone else?
Yeah, Bob, I just also wanted to say that,
Me.
sorry, I'm kind of stage fright, I guess. I just also wanted to highlight that a couple of the public comments pointed out the fact that we are only one of 6 states that are still addressing this issue. And we would be the only town out of Uncas Health to extend this. And I still can't really support this motion myself.
Okay, thank you. Any other comments from
I
the board?
can't put my, Bob,
Christine?
Bob,
Christine?
Yeah,
hear you,
sorry,
Chris.
I can't find my hand.
It's right
I
here.
just want to remark on the, yeah, it's not working on my thing. I just want to remark on the higher incidence in Norwich. We also have to remember that there's more tests being done, and that automatically elevates the numbers right there. We've been giving out free tests to everyone throughout the community, so more testing is being done. So a lot of these incidents could even be the regular flu. So there's a lot of mitigating factors that come into this. And as to the confusion, I say let the parents deal with it. That let them remind their kids, have a mask in their backpack, leave it in their hands. It's time for this to end. It's just ridiculous. And people who are aware of all the scientific facts that are out there, the CDC isn't even releasing half of the data that they were supposedly accumulating. So it's hard to even go by the CDC. Unfortunately, we have to for guidance, but it's time to end. It's time to end it.
Yep.
That's it.
Thank you, Christine. Is there anybody else, any one of the other board members have any comments under this motion?
So what was that?
Okay. I'm gonna call the vote. Amber, could you do the roll call? When your name is called, you either say yes or no. Yes, you are approving the motion. No, you are not approving the motion. The motion is to extend the mask mandate to the 18th of March. So when school, through the school day of March 18th, and when school resumes on March 21st, which I believe is the first day of spring, masks will be optional. Amber?
All right, I'm just going to go in order how you are on my screen. Mr. Chapman,
No, I will not be voting.
no, you're voting.
No, I'm voting no, I'm sorry.
Okay, Mr. Saitani,
Kevin Saitani, I will be voting to extend the mask policy until March 18th.
Ms. Fowler,
My answer is no for extending. I think it's an absolute smack in the face to the Norwich students when 8 out of 11 towns in the Uncas district have now went mask optional. I think once again, you are not considering the parents' opinions, and it's very sad.
all right, Ms. Sharmalis,
I am going to vote yes to extending the mask mandate until March 18. And I am hearing everyone's concern, and I'm also hearing what our teachers had to say as well. So that's what I'm basing my decision on tonight.
Ay, Dios mío.
Ms. DeStachio,
I'm voting not to extend it till March 18th.
Good.
okay. Mr. Aldi,
I vote yes to extend it to March 18th.
all right. Mr. Perry,
Okay, I vote yes.
Of course you do. Of course you do.
Who is that person? Whoever it is, mute him. It's not you, Heather, I know that.
and Mr. Poulos.
Yes, I vote to extend it to March 18th. I base my decision based on the comments by teachers and by the infectious disease expert who was kind enough to call in and said we should give ourselves at least a couple more weeks. He said a couple more months. I'm not willing to go that far. I think the 3 weeks is will let us know what happens. And remember, whatever we do tonight, the fact that it may be extended, there is still the power of the State Department of Education and the State Public Health Department. If the numbers go south again, they can reinstate the mask mandate at any time until the end of June. So they could overrule us at any time.
Amber, could I have the count, please?
We have 5 in favor of extending and 3 not in favor. So the motion carries.
Motion carries. Thank you, everybody. Motion for adjournment. Motion to adjourn.
Carleen will make that motion.
No, we're muted.
We have a motion on the floor, seconded by Greg Perry. All those in favor?
Aye.
You want to just do a hand raise since most of
Yes,
them are
please.
muted?
Yep. I can't see them all on my screen. Anybody opposed to the adjournment? So carried. Meeting is concluded. Thank you very much, everybody. Have a great evening.